This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset me.
Painful, tender to the touch. May also
Same shoulder length, and the other.
Well, hey everybody, welcome back to another episode of the Real Health Podcast with Brandy and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandy Rashidian is Mrs. Dr. Chiropractor, and she's not a
That's
chiropractor, but she knows more than most chiropractors.
I know a few
And
chiropractors.
That's true. You know quite a bit. And the Real Health Podcast is where we take all the latest information in health and wellness, whatever's in mainstream media and the news, and we break it down for you. We discuss it. We share it. We give you our perspective from a drugless, non-surgical health perspective. And our focus for you is that you'll feel better, get stronger, live longer, and feel younger. As always, the Real Health Podcast is brought to you by the Frederick Podcast Network and can be found on listenfrederick.com along with YouTube and Spotify and iTunes and everywhere else.
All the others we don't know about.
Use for your podcasts. So today we are finally going to get to talking about this special supplement.
He's been making me giggle off camera about how he's
I said his name
this.
is Tonin, first name Mel, middle initial A. Mel A. Tonin. And so we talked about it a little bit 2 episodes ago.
Yeah, I don't even know if we got through
a little bit of this
maybe
article.
a page or two.
But it is just deep, and it has, what I've learned about melatonin just from these couple articles has been, I don't know, just eye-opening. I really had no idea what melatonin was. I thought I knew.
It made you retract earlier thought process and belief system, which is really kind of fun to see. See, even we can do that.
Right.
So.
And I'll tell you up front, different experts whom I actually value their opinions of disagree with what we're about to share with you. So like, I believe Matthew Walker, who wrote the book, Why We Sleep, says never more than 1 to 3 milligrams of melatonin, and only if you're jet lagged or you do shift work, or you're in a different time zone, or you're in a hotel room, you're having trouble falling asleep. And he says never more than 3 milligrams and shouldn't be every day. And then now we're finding out here that high doses of it daily are actually extremely beneficial. So
As you get to a certain age.
Right.
You know what I mean? So, and I think that's the conversation or the caveat that's there, is that this really seems to be something to assist us in our plight for anti-aging. Now I still don't believe there's any one thing by itself that is going to make such massive changes in your health that you don't need to do anything else. So we are never going to say, if you take high doses of melatonin, now you can go out and eat your favorite fast food every day and not exercise. And that is not it.
It's going to sound like that when we go through this.
Right. But just
that
keep
is
in
not
mind,
the message. And we'll review that again at the end.
Exactly. Just keep in mind that, there is some really amazing research that's been done. And I think we need to have this. And I think it's going to help so many people to be able to kind of push things, the needle in a direction on their health that maybe they've been stagnant. You know what I mean? So you're doing all of these other things. You're getting your vitamin D. Your body has the minerals that it needs. You're getting, all the other nutrients, on the norm. You're exercising regularly. But there's a couple of these disease processes that maybe took you by surprise, or, maybe you're not getting as much, great nutrition as you thought. And there's some things that are failing. Or not moving in the direction you want. I think this could be one of those things that assist in moving that needle.
I am certainly excited to try it.
Me too.
So why don't we jump right in?
Okay.
And a little review of 2 episodes ago to start. So this article was given to us by a patient, and he just wanted to get our opinion. And it actually stayed with me for about a year before I finally read it, just because I thought I knew about melatonin. The title article was Why Everyone Over 50 Must Take Melatonin. And it says, if you are over the age of 55, your natural melatonin levels are now close to nothing. Melatonin levels are very high in childhood and adolescence, but start a steady decline in your 20s. By the time you reach your 50s, your body is producing about 5% of what it did in your prime years. The main reason for prime years are the main reason our prime years are prime is because that's when we produce an abundance of melatonin. And see, by this time I was still extremely skeptical.
Right.
Melatonin is so important to overall health that it is produced everywhere, in the pineal gland, in the brain, in most tissues in the body, including intestinal tract, retina, eye lens, cochlea, the trachea, the skin, liver, kidneys, the thyroid, pancreas, thymus, spleen, and in the reproductive tissues. I wonder what it didn't mention. What, fingernails?
Yeah, what's amazing is it doesn't just say that it exists there or it's stored there. It's produced
Yeah.
in all of those different
Right.
areas. And not to mention, like the melatonin that's produced in the brain, they say is different than the melatonin that's produced in the stomach and
That's right.
digestive tract, which is fascinating because what's in the stomach and digestive tract is not dependent on light.
Exactly.
So who knew? I had no idea. This was
Yeah,
really
it says it is
interesting.
present in nearly all bodily fluids. Cerebrospinal fluid, saliva, bile, synovial fluid, that's what you have in your joints. Amniotic fluid, urine, feces, semen, and breast milk. A healthy body on average produces up to 360 milligrams per day of melatonin. Most of that is produced in the intestinal tract. And now new findings have shown that one of the reasons mitochondrial function is also vital is because the mitochondria are pivotal for melatonin production, melatonin metabolism, and melatonin receptor activity.
Fascinating.
So as they become less efficient, so as your cells become less efficient, the mitochondria produce less melatonin. The result is premature mitochondrial decay, leading to premature aging and greater susceptibility to disease. Also, the levels of melatonin are significantly higher in mitochondria than in blood. Incidentally, this is why it is useless to try to measure melatonin in blood, saliva, or urine, due to the fact that so much melatonin is intracellular and not in the blood. These tests only account for a tiny fraction of the body's total melatonin.
That was so surprising to me.
I agree.
Yeah.
I agree. Melatonin is unique in that it is soluble both in water and fat. This means that, soluble means it dissolves in.
Right.
Like the oil only dissolves in oil. Water soluble things dissolve in water. Certain vitamins are fat soluble. They only dissolve in fat. That's why you should take them with fat, like vitamin D and vitamin K, vitamin E, vitamin A. This means that it can freely flow among all body tissues across cell and mitochondrial membranes and across the blood-brain barrier. I mean, it seems like this is the most common substance in the entire body. The fact that it can be dissolved in water and fat.
Right.
It's important for optimum brain and nervous system function. Melatonin is the most important mitochondrial antioxidant because it is the only antioxidant that can penetrate the mitochondrial membrane.
That's fascinating.
It is also the most potent antioxidant. That's because it can scavenge every form of oxidant and free radical there is. Now, oxidants and free radicals cause aging, and they cause damage to the DNA. And that's why antioxidants and things that remove free radicals make you healthier, stronger, and younger.
And they protect your DNA.
They do, which is related to aging and diseases like cancer. So it says melatonin not only maintains mitochondrial balance and protects against decay, it also regulates the expression of our genes and controls inflammation and immunity.
I think this is super important because I think that here in the United States, especially, one of the biggest issues is inflammation.
I agree.
and which is directly tied to our food.
Yeah. Oh yeah. Or lack of natural food.
Well,
What
correct.
they call food.
Well, that's ultra processed crapola. It's not really food,
Yeah.
but
One of the ways it decreases inflammation is by blocking the pro-inflammatory COX-2 gene. It is important for optimal immune function because it stimulates Th1 immune helper cells, TREGs, and Th17 immune cells. If that is not impressive enough, melatonin plays a critical role in programmed cell death, which is called apoptosis, making it important for cancer prevention, cancer growth, and senescent cell removal, which is removal of senile cells. Crazy cells.
crazy cells.
Diseased cells. Cells that are acting funny.
Some of us are going, wow, I wish that had eaten through some of my family crazy cells. That would have been good. Had a lot of those.
Overall, age-related decreases in melatonin production are correlated with disease and dysfunction. In vitro and in vivo studies demonstrate melatonin's protective ability against mitochondrial-mediated injury in hypertension and obesity, suggesting that dietary supplementation with melatonin in later years may be an effective therapeutic intervention for such age-related conditions. And that's kind of where we stopped on the last podcast that we were talking about melatonin. So here's some new stuff. Melatonin production also decreases during chronic illness and with a poor diet, medication use, and a lack of physical fitness. You know what's interesting is I was also reading earlier that you know how people who have lower pain threshold are susceptible to pain syndromes, like fibromyalgia. Well, do you know what lowers your pain threshold?
What?
Painkillers.
Wow.
So people who take a lot of painkillers, even over-the-counter painkillers, when they take a lot of it, then things that normally wouldn't feel painful start to cause pain. That's why some people, you pat them on the back, they say, ouch.
Yeah. You know, it's so funny because there's some over-the-counter medications that you can get to help you with, you know, if you have acid reflux and things like that. Some of those have calcium in it, which then creates that same...
It's a rebound effect for more acid production, which leads to more heartburn.
And I just go, wow, you guys are brilliant to be able to create a product that actually creates that
that's why
cyclic
people with
issue.
heartburn keep it in their pocket and they keep popping them.
Oh my gosh. So...
But this says medication reduces production of melatonin too. So, I mean, that's why medication should only be used as a last resort.
Well, and look at how many people in our communities would fall into one of these. So melatonin production is decreased by chronic illness.
There you go.
Look around you. Look at your family and your circle.
That includes people with just high blood pressure. That's a chronic illness.
100%.
Pre-diabetes.
If you're on a medication, they're considering that a chronic illness. Poor diet. Well, if you're in the United States, you're probably one of those people, at least in part.
At least.
Medication use, don't even get me started because the high number of people, I mean, it's probably easier to count people not on medication than those that are.
The average American over the age of 65 is on 18 prescription drugs, something crazy annually. So at different times, that's a lot.
That's crazy.
Now, the people we know over 65 are on zero. So think about that. So that means you average zero with someone who takes 36 prescription drugs and it adds up to 18.
Right. So we're looking and we're going, yeah, there's a lot of our, adults in more mature adult population that's experiencing that. But then look, it goes on to say production is reduced also from exposure to artificial light, especially blue light coming from cell phones, computers, and fluorescent lights. So what we're actually seeing here is that those numbers that they're talking about, I would venture to say would be, we're probably losing melatonin much earlier than 50s.
Yep.
Right? Because we're inundated. Our kids are inundated. If they're sitting in a classroom, they're under fluorescent lights. If they're home, they're probably, a good number of them are watching TV. They're on devices. Hopefully we're sending our kids outside to get, vitamin D and fresh air too. But the reality is I think this is probably a lack of melatonin is more systemic in our society than what we'd like to admit.
Yeah, blue light exposure after dark disables the signal to the pineal gland to produce it for initiating sleep,
Right.
causing insomnia and other sleep disturbances.
Hmm.
The researchers in a recent review of the published data on melatonin have described it as a potential therapy for aging skin, gout, sleep disturbances, mood and cognitive disorders, migraines and other headaches, tinnitus, like ringing in the ears, ADHD. Oh, autism. I should take this. Brandy thinks I'm autistic.
Oh, I said you have autism.
Yes. Glaucoma, macular degeneration, hypertension, metabolic syndrome, preeclampsia. That's when pregnant patients have high blood pressure.
Mm-hmm.
Infertility, endometriosis, polycystic ovarian syndrome, heartburn and acid reflux, ulcers, irritable bowel syndrome, autoimmune conditions like multiple sclerosis, Hashimoto's, thyroiditis, COVID, oxidative stress from athletic performance. Hey, I might need that too. Environmental toxins,
We all need that.
cancer, and osteoporosis.
That's wild. And you can see not all of these are aging diseases that they're talking about.
Oh,
Do you
yeah.
know what I mean?
Right, yeah,
When
yeah.
we're
You can be
talking
young and
about-
you can have these things.
Yeah, PCOS and, irritable bowel,
Yeah.
different autoimmune. I just think this is fascinating information.
Yeah, I think I'm sold. Just give me
Now we
some-
have to test. What I would love to do is take a good number of individuals that are willing to go through and do the right stuff. Like, will you be willing to take a high dose of melatonin? Make sure that you're getting your time outside or supplementing with vitamin D, but much better to be outside. Somebody who's eating right.
Yeah.
Right, doing good exercise, and let's see what changes. I think that would be so cool. I mean, in the next article we're going to read, they're talking about 2 months of people seeing really amazing changes. So we're not talking like you have to do it for a year.
Yeah.
I would be willing to test it for 3 months and see what happened. Who's ready to join me? Let's do our study.
Let's do it. So now we're going to go through some conditions like aging skin. Melatonin is formed in the skin and acts to ward off the damaging effects of ultraviolet light. As such, it decreases the chance of sun-induced cancers. Melatonin, both orally and topically, may be able to decrease wrinkling, loss of elasticity, and rough texture appearance of aging skin.
Where can I find melatonin cream? Do they make that? I'm going to look it up for us.
All right. So now gout, which is a painful condition. Typically, it's gout or crystals that form inside the joints,
Very painful.
often in the big toe, and it's extremely painful. Scientists have discovered that patients who get gout attacks have much lower levels of melatonin than people who don't get the attacks. Additionally, melatonin receptors on the cells are lower in gout patients, so the melatonin levels they have are not as effective. So not only do they have low melatonin levels, they have fewer receptors in their body for the melatonin.
Do the receptors go away, or do they just naturally have less receptors? That would be my question.
Yeah, I don't know.
Or do the receptors stop working?
Good question. Like in the case of type 2 diabetes, the receptors for insulin become resistant to insulin. So I don't know. This could be one of those. Also, when patients with gout have an acute attack, they have much lower levels of melatonin than when the attack is over. So they actually have higher levels when they don't have an attack. So it could be one of those things where it's like correlation versus causality.
Yeah.
You know, does the gout attack cause the melatonin to go down, or does low melatonin
Cause
cause them
the-
to have an attack? I don't think it says that. So it seems that gout attacks may be more likely to happen in people with the genetics for it when melatonin levels are low. So, I mean, it'd be a great experiment to keep melatonin levels high in gout patients and see
Yeah.
what happens, see if
Yeah.
they get fewer attacks.
It's very cool.
The researchers gave melatonin supplements. Oh, here it is, but they did it.
Hey,
Gave melatonin supplements to mice that were prone to gout. Mice have a big toe? Do mice have two big toes?
I don't know. Well, we'll have to look into that.
What does the big toe of a mouse look like?
I mean, they have to have some toes.
They have toes, but is it the same kind of like big, like does the gout affect their big toe like in humans? Because I mean, the human
maybe it
big
affects
toe
all
is
their
very
toes.
different than all the other toes.
Really?
It's big.
I mean, it's big.
Yeah.
But what
Called
else
the
is
big
different?
toe. Like big guy, it's the big guy of toes.
I don't know if anybody has had a big toe conversation before, so this is probably going to become
Especially
a short.
regarding mice and the disease gout.
Okay, if you know if mice have big toes, can you please
Comment
down below?
Comment, yes, let us know. So they found that the inflammation and the swelling decreased significantly along with many of the markers of inflammation during an acute attack. They concluded, our study demonstrated that melatonin alleviated gouty inflammation in vivo and in vitro. Other researchers have found that melatonin supplements decrease the activity of the enzyme xanthine oxidase, which is critical for gout attacks. Either way, I mean, if you can't go wrong and you can't overdose,
Right.
and there's a chance it'll reduce the frequency of gout attacks,
Then why not?
oh my gosh,
This just seems like a safe
it's simple.
thing
Yeah.
and inexpensive. Safe and inexpensive.
Better than the drug they take. It was the drug called Purinol, I think they take.
Yeah.
So, although remember, sumac reduces uric acid,
Oh yeah.
which is like uric acid crystals are what cause gout, and so you lowering your uric acid in the body can do that as well.
Sprinkle that on your food.
Yeah, the herb sumac, you can find it at every Persian food store.
Yes.
Or Persian restaurants.
I love it.
Tastes good. You put it on your kebabs.
Yeah.
Mood and cognitive function. Melatonin supplementation not only improves sleep and neurotransmission, it also improves cognition and mood. We may need that too. Our mood has been up and down.
Well, yeah. The sun too. I mean,
Yeah.
that
In a
weather
small
plays a part.
pilot study of elderly patients with mild cognitive impairment, the ability to remember previously learned items improved and depression decreased
Oh my
when they
gosh.
supplemented with melatonin. I mean, like, can you imagine what was that movie with Robin Williams where they were all catatonic and they gave them L-Dopa and they came to life for a period of time and then they
Yeah.
went back to being
what was
catatonic.
the name of that? Oh gosh, what a great movie.
It was good.
Oh, we should watch that again.
All right.
At least I remember it being great. How many movies have we like in our memory watched and it was great and we went back and we're like, that was not great. I hope that's not one of them.
This one was.
Okay.
This one was.
Well, TBD.
Awakening. Was it
To
called
be
Awakening?
continued. Yes.
Awakening.
I think that was right.
Don't quote me on that. Just look it up. But if the movie Awakening has Robin Williams in it and
It's probably the one.
he's catatonic in a wheelchair. Anyways, but I can just see it like let's go to hospice
And give everybody
and
high doses
pump
of
everybody,
melatonin.
inject everybody daily with a ton of melatonin and see what happens. Like they'll just come to life.
That would be fun.
Take them off all their drugs and pump them full of melatonin. All right,
Ooh.
listen, don't try it. I'm just imagining here. A more extensive, longer-term study found that patients with mild cognitive impairment scored better on cognitive testing and sleep scores when they took melatonin.
Well, and let's talk about the chicken and the egg, because we know that with poor sleep comes less cognitive
Yeah.
abilities,
Right.
right? I mean, from all you moms out there, how many of you are still trying to get your words back
Yeah.
from having kids? I mean, between being up all night while you're building a tiny human in your body
Yeah.
and having to get up
Pregnancy
to
brain
pee.
is a real thing.
Oh, it is a real thing. I remember so many times I would say a sentence and everyone would look at me and be like, "What did you just say?" And I'm like, I think we're going out to lunch or something. And I was like, "Is everybody ready to go to the hospital?" And they're like, "What?" And so it's a thing.
Sundowning is a term describing how patients with Alzheimer's get worse as the sun goes down. Melatonin reduces sundowning.
Which is awesome. I wish I had known that when I actually worked in a locked Alzheimer's unit.
Yeah, oh yeah.
Because I did that for several years and I loved being in that unit because it was fun number one. Hard to watch people with Alzheimer's. Let me say that. I've had family members with that. So that is tough to watch. However, being able to care for those individuals in the way that is now recommended, which is not trying to reset them, to current time and letting them live in whatever time era they are in their brain. That was really fun. But the challenging nights, especially full moons, were with our sundowners patients because they would, as the sun would start going down, they would be climbing the walls. Like their whole circadian rhythm was just so backwards is what it seemed like. It just they did not function the same way.
This makes so much sense. And it says it actually stops the progression of the disease as well and reduces plaques in the brain, the beta amyloid plaques that build up. It says since melatonin is such a strong brain antioxidant, it makes sense that melatonin may act to prevent age-related cognitive decline.
Gosh, that is so why would anyone not be on it?
Yeah.
Do you know what I mean?
Unless they want you to decline so they can give you drugs and put you in those mental hospitals and
have
a young Brandy take care of them.
Yeah, some did enjoy that. And melatonin isn't a moneymaker for big pharma. So we need to remember that.
Yeah, neither is headache medication or getting rid of headaches. It says amitriptyline is a drug that has been approved for migraine headaches. One study compared the effects of amitriptyline, melatonin, and a placebo in patients with chronic migraines. After 3 months, melatonin had reduced the frequency of migraine headaches every bit as well as amitriptyline.
Without the side effects.
And no prescription or any of that. And it's probably cheaper. When they looked at the number of patients who had greater than 50% reduction in their headaches, melatonin was superior to amitriptyline.
Wow.
Other studies have shown that melatonin can be effective in other headaches, including tension headaches and cluster headaches. Now, there's a condition called tinnitus that he talked about, which is ringing in the ears. And in fact, one of my patients, very well, she likes to bowl.
Oh, mm-hmm.
You know who I'm talking about.
I do.
She actually, after her adjustment, with a 3, she broke a record in a 3-game set. And she called the office to make sure we knew that she did. So I hope she's watching or listening. Yeah, we're so proud of you. But anyway, she was in tears because the tinnitus keeps her awake at night, and she was being really really sad about that. And now I'm thinking I should have recommended this.
Well,
so maybe I'll call her up
now
after.
We know.
Researchers gave melatonin to 61 men and women with tinnitus and compared the effects to a placebo pill. They found melatonin is associated with a statistically significant decrease in tinnitus intensity and improved sleep quality in patients with chronic tinnitus. The effects were greater in men than women, and especially good for men with a history of tinnitus caused by noise. So, people use firearms and, their eardrums have been affected. They get some ringing in the ears. Melatonin can help. How about ADHD, attention deficit hyperactivity disorder? While there are no clinical trials of melatonin in case of ADHD, there is considerable evidence that it will be effective in some cases. Genetic testing suggests a melatonin signaling deficiency in ADHD. Sleep disorders are common in patients with ADHD. Most patients with ADHD have a disturbance in their circadian rhythm such that they are less affected at night and worse during the day. Patients with ADHD typically have lower pineal melatonin production.
Okay, but this week, everything that's coming out is the same scientists who created the ADHD diagnosis are now coming back and saying, I think we've misinformed people. So we need to talk about that on an upcoming article or an upcoming podcast, because New York Times just put out an article on that, and it's big.
Yeah, we'll do it. Let's find the article and talk about it.
That's why there are no clinical trials, because they're saying it's not actually a real diagnosis or disease of the brain.
Yeah. Well,
and they've never had any evidence to speak of.
Yeah.
Come on,
I
big
mean,
pharma.
one of our kids looks like he has ADHD, but you give him a book that he likes,
Right.
he'll sit and read for hours.
Right.
You tell me he has ADHD,
Correct.
he's reading.
They can also play electronics without an issue.
Yeah.
For any extent, if
Watch
we let them
movies.
for hours on end,
Yeah.
watch movies. So now you put them in front of a screen, and you put a geography lesson or a math lesson, they may get bored, but that's called boredom of a kid. That's not ADHD. Now, I will contest that I still think there can be a messaging issue, right? We know that messaging can create symptoms that they refer to as ADD and ADHD.
Right.
But that's
otherwise,
a different
stimulating them with a stimulant drug wouldn't have an effect if that
Right.
wasn't the case. But still, like, you stimulate them, they can focus better. That makes sense because
Correct.
you're waking them up.
Right.
So, anyways, autism. Patients with autism are known to have decreased mitochondrial function. The brain is more dependent on mitochondrial function than any other part of the body. Melatonin is a potent mitochondrial stimulator. Could it be that melatonin might help in autism cases by improving brain mitochondrial function?
I would say, what do you have to lose to try it?
We're tomorrow, I think we have an autistic child coming in
Yeah.
as for a brand new visit to
Well, this will be a great
see
conversation.
if we can help. Yeah. One review article found that patients with autism had improved sleep parameters, better daytime behavior, and minimal autistic-related symptoms when taking melatonin. For autistic children who tend not to fall asleep until very late, which is delayed sleep phase syndrome, melatonin in doses between 0.2 and 0.5 milligrams worked best when given 6 to 8 hours before the desired sleep time. That's a very low dose.
Very low.
0.2 milligrams. And then, again, I wonder if that one was injected or oral.
Right.
One review article looked at 9 different studies measuring melatonin or melatonin metabolites in autism. The researchers found that all the studies reported at least one abnormality. 4 of the studies found an abnormal melatonin circadian rhythm. 7 studies found below average levels of melatonin. 4 studies discovered that the lower the melatonin levels were, the worse the autistic behaviors were. 5 studies reported gene abnormalities that could contribute to decreased melatonin production and function. 6 studies reported improved daytime behavior with melatonin use.
Wow.
Somebody should tell RFK Jr. about melatonin.
No kidding.
It says they also reported on 18 studies that specifically looked at the effects of melatonin supplements in patients with autism. These studies showed that the patients taking melatonin fell asleep faster, slept longer, and had fewer nighttime awakenings. They concluded melatonin administration in autism spectrum disorders is associated with improved sleep parameters, better daytime behavior, and minimal side effects.
So even if you get that, that's such a huge win.
Come on.
Come on. And you have nothing to lose by trying.
Oh my gosh, yeah. And it's such a small dose that they were giving them. Unbelievable. REM behavior disorder is a sleep disorder that involves unusual sleep behaviors like thrashing around and talking and or walking during sleep. One of my patients yesterday said, "I'm a rotisserie chicken when I'm in bed. I bounce around a lot."
That's cute.
I wonder if that's RBD. REM behavior disorder. It often indicates that Parkinson's disease is on the way. Ooh, that's scary.
That is scary.
So, like, you're listening to this, you're going, man, I thrash in bed when I'm sleeping. I'm all over the place. I wake up, my head on the other side of the bed, and then this all of a sudden says it's an indication that Parkinson's is on the way. That's pretty scary.
Yeah.
Researchers gave melatonin before bed to patients with RBD, and in only 4 weeks noticed a significant decrease in RBD symptom severity. The improvement was maintained over the follow-up period of 4 years.
That's
give
amazing.
Give or take 3 years. So between, I guess,
1 to 4 years.
1 to 7.
Or 1 to 7.
Yeah.
Okay. Yeah.
1 to 7 years. And then there's gynecological benefits.
They did find that it was safe to supplement during pregnancy, and it's been found to be safe for both mother and baby,
Yeah.
which is amazing.
Numerous studies agree that short-term melatonin therapy is highly effective in reducing complications during pregnancy, such as preeclampsia. Additionally, melatonin decreases complications during critical periods before and shortly after delivery.
Gosh.
Endometriosis is a very common, often serious condition that can cause severe menstrual irregularity and pain. I mean, people have hysterectomies when they have endometriosis.
Yeah.
In a randomized double-blind placebo-controlled trial, researchers found that supplementing melatonin at night for 2 months reduced the pain by about 40% and
That's
reduced
huge.
the use of pain-relieving medication by 80%.
Oh my goodness. So not only did it reduce the pain, but it overall they needed so much less
They needed
pain
80%
reliever.
less pain
Yeah,
medication.
That's huge.
Then there's PCOS, polycystic ovarian syndrome, is a hormonal disorder affecting 5-10% of women. Symptoms of PCOS include high levels of testosterone, facial hair growth, acne, insulin resistance, abdominal obesity, missing or having excessive periods, poor sleep, and decreased fertility. Researchers have discovered that the circadian rhythm in patients with PCOS is abnormal and the levels of melatonin are decreased.
Wow.
One study looked at the effects of melatonin supplements over 6 months in 40 women with PCOS. They found that the supplements decreased the elevated testosterone levels and the menstrual irregularities in 95% of women.
95%. That's darn near 100, just in case anybody wasn't mathing with me. That's huge.
That's 38 out of the 40 in the study
Oh my
showed
gosh.
improvement. The authors attributed the results to a direct effect of melatonin on the ovaries. Delivery by C-section is often associated with higher levels of pro-inflammatory cytokines compared to vaginal birth. These cytokines act to decrease melatonin synthesis. When researchers gave women melatonin before a cesarean section, it reduced the severity of their pain and the amount of pain medications they needed, plus it got them up and about more quickly.
Wish I had known that.
Well, you didn't take pain medication.
No, I didn't take pain medication.
But you did have pain, but you didn't.
Right. I didn't take it once I got home. Whatever they gave me in the IV is the only thing I got.
Yeah.
But they're saying even it helps to get you up and moving
Yeah.
after your C-section even faster. So reducing the pain and probably the inflammation and things like that. How
Yeah.
amazing. So
And then there's viral infections, because we talked about immunity. It says because it acts as such a powerful immune regulator, antioxidant, and anti-inflammatory, melatonin has been included as one of the top recommendations along with zinc, selenium, vitamin C, and vitamin D for both the prevention and the treatment of COVID-19.
wait, I'm going to tell you, this is the first time I've heard that. In all the data, did you ever hear that during
I mean,
COVID?
it was 5 years ago,
I know.
and now we're hearing it for the first time.
After the fact.
Yeah.
Like, that's crazy. They didn't even want to tell us. We could not talk about vitamin D.
We
and
were
vitamin
not allowed
C.
to say zinc, selenium, vitamin C, or vitamin D.
We were if we had said that on anything during COVID,
I would lose my license. They warned us. They literally warned us. They do not talk about immune improvement. Don't say it. So I wasn't allowed to.
This is the kind of stuff that actually like infuriates me.
Yeah.
Because I go, look at how many people could have been impacted positively, maybe saved, you know what I mean, from these horrific long-term illnesses. Shame on you people. That is just, it's a shame that we weren't able to say what we needed to say. Now, we didn't know about the melatonin, but sure as all get out, we would have been investigating
listen,
that.
If this stuff was harmful, then yeah, tell me not to say it.
Correct.
But can anyone be harmed by taking zinc, selenium, vitamin C, vitamin D, and melatonin? Who's it hurting?
Matter of fact, all the research on vitamin D even says they created a toxicity level much lower than what it actually is.
Correct.
To keep people's vitamin D levels down.
Correct.
This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.